Hello, welcome to sonography-radiology training channel. This series of videos is a scientific presentation about fetus ultrasound. This is the 10th video in this video series about another soft markers of aneuploidy named echogenic intracardiac focus. What is the incidence of echogenic intracardiac focus? An echogenic intracardiac focus is the most common sonographic soft marker observed at the time of second trimester anatomic survey, occurring in 3 to 8% of all second trimester sonographic examinations overall. They have been reported in up to 12% of normal Asian fetuses but are less common in normal fetuses of other ethnic groups. What is the pathology of this focus? This finding is thought to represent microcalcification and fibrosis of the papillary muscle and chordae tendineae, although their exact etiology is unclear. What is the clinical significance of echogenic intracardiac focus? Despite their high prevalence, the clinical significance of it remains controversial. According to some studies, an isolated echogenic intracardiac focus is not associated with structural cardiac abnormalities or myocardial dysfunction based on pathology correlation and long-term childhood follow-up studies. According to many studies, initially observed a normal variant, but these foci have been associated with slightly increased risk for trisomies 21 and also 13, and questions as a marker for cardiac structural abnormalities. Similar to pyelectasis, echogenic focus tends to perform best for the detection of Down syndrome in the presence of other sonographic markers with positive likelihood ratios ranging from 2.8 to 8. Detection of an echogenic focus warrants a detailed examination for other features of these aneuploidies, particularly in a high-risk population. What is the imaging technique and appearance of echogenic intracardiac focus? An echogenic focus is best seen in the 4-chamber view when the cardiac apex is pointed up toward the transducer. They are visualized as non-shadowing lesions measuring less than 3 mm that are isoechoic to bone and located within the cardiac ventricle in the region of the papillary muscle. The most common appearance is a single focus isoechoic to bone and within the left ventricle, which accounts for 60 to 90% of cases. However, either ventricle may be involved, as we can see here an echogenic focus in right ventricle, and multiple echogenic foci may be visualized also, as we can see here multiple foci in left ventricle. Biventricular foci are more frequently associated with aneuploidy, but they should persist throughout the examination. As we can see here, bilateral echogenic foci in the setting of aneuploidy in a 25-year-old woman referred for lower urinary tract obstruction at 17 weeks gestation. Axial images through the heart demonstrate bilateral echogenic foci, and these bilateral foci persisted with the rotation of the transducer. With biventricular foci, additional anatomic abnormalities are usually demonstrated. As we can see in this axial image, bilateral echogenic foci, and in oblique image through the heart reveals an overriding aorta in the patient with tetralogy of follows. As we can see here, a overriding aorta on right and left ventricles. What is the pitfall and mimics for these foci? The first one is echogenic cardiac reflectors, rib cage artifacts, and cardiac rhabdomyoma. The first one is echogenic cardiac reflectors. The most common mimics of echogenic focus are artifacts from specular reflectors. These artifacts are usually created when the transducer is positioned perpendicular to a potential interface, including the endocardial cushion, moderator band, tricuspid annulus, chordae tendineae, normal papillary muscle, and mitral and tricuspid valves. Distinguishing between specular reflectors and a through echogenic focus is accomplished by rotating the transducer slightly away from the cardiac apex of the 90-degree angle, at which point specular reflectors will disappear, whereas echogenic focus will persist. Other example of specular reflectors. In this axial image, we can see specular reflector from a hypertrophied right ventricular wall in a fetus with double outlet right ventricle. Another example, this axial chamber view demonstrates a specular reflector arising from the mitral wall, which was confirmed through visualization of the moving valve moments later. Another artifact is rib cage artifacts. Other artifacts may include the artificial creation of a bright focus at the outer myocardium due to inclusion of the anterior edge of a rib or part of the sternum within the imaging plane. In this case, obtaining an image in the long axis dimension of the rib or sternum will demonstrate the true nature of this artifact. As we can see here in this four-chamber view, a small echogenic foci at the apex of left ventricle, but rotating the transducer shows a longer section of rib and pitfall can be recognized. And the last pitfall is cardiac rhabdomyoma. Cardiac rhabdomyomas are hamartomas that appear on ultrasound as hyperechoic masses involving the ventricular septum. These masses, which are variable in size, are often much larger than the punctate appearance of echogenic focus. When large, they can compress or narrow the cardiac chambers. This is cardiac rhabdomyoma in 31-year-old woman referred for cardiac mass at 23 weeks gestation. Axial image demonstrates an echogenic mass within the apical aspect of the left ventricle. The mass contains punctate echogenic foci, likely corresponding to microcalcifications. By rotating the transducer, the mass is seen to abut and likely arise from the interventricular septum. Now, please pay attention to these final teaching points. An isolated echogenic intracardiac focus is not associated with structural cardiac abnormalities or myocardial dysfunction, and the probability of its association with aneuploidy is very low. Biventricular foci are more frequently associated with aneuploidy. Always be careful not to be misdiagnosed echogenic focus with pitfalls and mimics. The incorrect diagnosis of an echogenic focus should be avoided given the anxiety it provokes and the potential for unnecessary invasive testing. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.